My mother was a nurse growing up, and I think that sort of guided me. I did some shadowing going through. It was just always drawn towards it. Going into Ohio State, the Ohio State University, I specialized or majored in human nutrition and pre-medicine, and then stayed there for medical school afterwards. It was then early on in medical school that I was drawn towards orthopedics. Like I tell most of my patients, it's like sterile carpentry. I always enjoyed working with my hands growing up, building things, doing shop class, and orthopedics was kind of a natural draw. I see patients all the way from very early knee or hip pain when they're just being diagnosed, could be at a very young age even, all the way up to those patients who may be needing to decide when to pursue joint replacement surgery, or who have already pursued that years in the past and are looking to maybe need the knee or hip redone. I think one of the biggest compliments you can get is exactly when a patient says that, "I wish I would have done this years ago." Unfortunately, it's an easy but difficult decision is what I tell patients. It's easy because you're deciding on a joint replacement, which is essentially an elective procedure. And it's difficult for that very reason, because you're not deciding between life and death, and it's a very scary thing to undergo surgery. So I try to guide them rather than point them which way to go, guide them and give them their options, the risks and benefits of doing the surgical route versus continuing with conservative or non-operative treatment.